Joining us now is Dr. Lee Gross. He just had a fantastic op-ed that we're going to talk about in a moment. Dr. Gross is the founder of our Northport practice. He's a 3-time recipient of the Northport Sun Readers' Choice Award for Best Physician. He has been front and center in trying to get schools open across the country, and he did an op-ed the other day, which was spot on. And, of course, that now coming under fire by teachers' unions and other things of that nature. And it was called COVID-19 Increases in Florida Don't Justify Broad Shutdown in Closing Schools. And he's joining us now. Dr. Lee Gross, thanks for being with us, sir.
Good morning, John. Greetings from sunny and steamy Southwest Florida.
Well, I tell you what, we're going to be in Orlando. We're leaving tomorrow. I'm going to be there for a couple of days. My son's staying for the week with Van as he's doing a baseball tournament. A lot of people have said to me, "Aren't you afraid going to Florida?" I'm like, "Afraid of what?" I don't live my life in fear, okay? And I'm not afraid. I mean, I'm 62. I'm about as healthy as can be. I get a few pounds I could lose. All right, let's not go there. Doctor, let's not go there. In fact, when I go to my doctor to get a physical, every time I get on the scale, he has reading glasses. He puts his reading glass down on his nose, and squints. And he looks at the scale and he says, "Oh, too high." I mean, I don't know. What does that mean? I don't know what that means, too high. Right? I could stand to lose a few pounds. All right, tell me. I'm happy, though.
I am standing presently in the domestic epicenter of the coronavirus pandemic here down in Florida.
What is going on there, Doctor?
Yeah, so I mean, the numbers are rising. There is no question that the numbers are rising. The number in the hospitals are going up. But the numbers that you're seeing statewide really are being largely driven by what's happening in 6 counties. 6 counties account for about 61% of the new positive cases in the state of Florida, which means that 67 counties are not experiencing a massive crisis. You're seeing, gloom and doom projections of ICUs, intensive care units, that are at 100% capacity. But none of those numbers really account for what's been done in the last 5 months to expand capacity, to improve the hospital's ability to care for patients. So just like an airline is designed to fly at near full flights, I mean, that's how they're designed. A hospital does not make money by keeping an intensive care unit bed staffed and empty. So the situation normal in a hospital is near full capacity of an intensive care unit. That is what we do all year, every year. And hospitals go on diversion because the intensive care unit is full. But we are now at arguably one of the world's worst medical crises in over 100 years. And what that means here in Florida is our response to that is essentially creating such drastic response that we're putting doctors into bankruptcy, we're putting hospitals into insolvency, we're killing our rural hospital communities, and we are furloughing nurses and canceling elective surgeries. The morbidity, and then we're closing schools. So not only is this just affecting the economics, it's affecting future generations to a point which, frankly, I'm not sure we can ever measure the impact of how we're responding to this virus.
All right, Dr. Gross, so you've got the leader of the Florida Teachers Union suing DeSantis and the state of Florida because they want to close schools down and not educate children, saying that they're putting teachers at risk, they don't have enough information, too many cases, there's chaos. What is your reaction to that?
Yeah, so the person directing traffic at Chick-fil-A can be an essential worker. The bagger at the grocery store can be an essential worker. The nurses and doctors are essential workers. Yet, I don't understand why the default position of educators, which is arguably the most essential position, the default is that the schools are closed. That to me just doesn't make sense because, again, they're the most important position that we have. So, the assumption needs to be that the schools are going to open. And then the question is, how can we do so safely for protecting the teachers? Because as we know, the children are going to do fine with this. In fact, the children are going to do worse at home than they are in school. So, in the state of, or actually in the entire country, we've lost 14 children to COVID. That is a very sad statistic. Those families that are affected by this, their death rate is 100%, and we will never be able to bring those children back, and we mourn the loss of those children. But we also mourn the loss of the 47 children in the same time frame that died from the flu. we have a vaccine for the flu, and more than half of the country refuses to take it. So while we have a contract federally with Pfizer to deliver 100 million vaccines, there's no promise of vaccines coming. We have to operate under the assumption that there is no vaccine. There's no vaccine for mono. There's no vaccine for AIDS. We have to operate under the assumption a vaccine is not coming. So we cannot just expect that we're going to hide this virus into submission. We have to make expectations and plans that our children and our future are going to be protected, and it's time to safely send them back to school. Now, that may look different in Broward County or Orange County than it does in Wauchula, because again, that's where the wildfire is burning. Also, keep in mind that if you don't feel comfortable sending your kids to school, there are virtual options available for anybody in the state of Florida. There's no cost for that. You can do that right now. You can sign up for that. Nobody's forcing the children to be in the school.
Basically, the teachers union is suing because they want the state government to not open schools, shut them all down, and so that teachers aren't at risk. Yet, why don't we do the same thing for, like you said, Walmart, Walgreens, Office Depot, Kroger, right? Winn-Dixie.
Right.
I mean, you could Publix. I mean, you could go on and on and on. You could basically say anybody, like you said, anybody that goes to work at Amazon. I'm sure that in Florida there's many warehouses there. Shut those down. I mean, you can take this to the extreme where you go back into lockdown and everybody stays home. So it fails me. But here's a couple of things you said, Dr. Lee Gross, that I want to put out also. Like you said, the 14 students who have died is horrible with their families. But this is across the country, and so we have to look at reality and numbers. So we've had 14 potential COVID deaths for adolescents in school, and by measure, you said 47 have died by the flu, which is an average number nationally that happens because of influenza. So we don't shut schools down for influenza because 50 kids die. How does this make any sense?
Frankly, it doesn't. And again, that's the whole point of the flatten the fear campaign. There is so much fear, and I understand. I understand the fear. We all watch the horrific scenes coming out of Italy as stretchers were piling up in the hospitals. But when you see this playing out in real time, and there is no question that there are hospitals that are being deeply affected by this. But if you look at just Florida, by example, when this first broke in Florida, we were admitting 30% of all newly diagnosed cases into the hospital. That number has dropped and has stayed flat at 3% right now. So 97% of patients that are tested positive for this are treated as outpatients. And so only 3% get admitted to the hospital. Now, those 3% are sick. And I'm not discounting, the experience that those people have. But had you said from the outset that a disease that is happening in Manhattan, that 97% of the people are treated as outpatients, Florida wouldn't have shut down for that. If this outbreak were initially in Wyoming, would Manhattan have shut down for it?
No.
Absolutely not.
Let me ask you this, Doctor. This is the other fear thing. Remember, the original lockdown, Dr. Gross, was over, well, we don't know what's going to happen, and we don't want to overwhelm our hospitals and run out of ICU beds and run out of ventilators. I remember Governor Cuomo in his TV show getting us said, we need 40,000 ventilators. We need 40,000 ventilators. We need 100,000 hospital beds. We need that in two weeks, or the whole hospital system will be overrun. Of course, none of that happened. In Florida right now, are you at ICU COVID bed capacity? It was the last I checked, you were at about 22% capacity. Where is it now?
Yeah, we have about 20% vacancy in the ICU. But keep in mind, those are just the presently licensed number of beds. That does not account for the hundreds of beds that have been designated for overflow capacity, surge capacity, that are essentially sitting empty. I sit on the board of my hospital, and I can tell you that our volume in the hospital is down 30% from this time last year. Yeah. Our emergency room volume is down, and that does not mean people are not having heart attacks and strokes. You're seeing a similar rise in the number of people by EMS that are found dead at home. Right. So now they're having their heart attacks and strokes at home because they're so afraid to go to the hospital from catching COVID that workers are sitting there with without much to do. So you point about, New York City. I'm looking at the New York Times article just from this morning that shows that they built a $52 million field hospital that treated 79 patients.
Right.
That's almost $1 million per patient.
Exactly. I mean, and what the fake news does with the available hospital beds and the politicians that are politically motivated play into it is they never give you the number of the total available COVID beds. They only give you the number of the ICU beds. Many of them are in utilization for different things. But each state, like I live in Virginia, the state of Virginia has sanctioned another like 4,000 beds that they found that are in waiting if we need them. Well, they're never counted in the number. You add those into the number, which is reality, and the capacity, it goes from a 40% capacity to we have 80% capacity open, 20% in utilization. So there is no fear of overrunning hospitals. That is all a facade. The bottom line is, like you said, 3% of the people getting sick there or testing positive are going to the hospital. You look at the number of deaths in Florida under 85. I mean, it's a pretty tiny number. Look, every death's bad. Nobody wants anybody to die.
Right. And if it's your family member or your friend, the rate, it may as well be 100%.
Exactly.
I get that. I mean, right. I'm not an animal. I understand, that every one of these cases and deaths is tragic, but we don't shut the country. I mean, deaths happen every day of horrific things. We don't shut the country down. We don't destroy our children's future over them. They are equally horrific and equally sad, but we don't destroy the future of our children over the response to this.
I read about a month ago that on the average in America, we have 330 million people. On an average, 7,500 people die a day, right? That's like the average. It's just the national average. And right now with COVID across the country in the past week, we're averaging about 100 deaths a day, but half of those are over 85. And so if you, the problem is if you're over 85 and you have COVID and you die from a heart attack, stroke, natural causes, or just old age, right, as we typically say, it's going to happen to all of us. If you contracted COVID, whether it contributed or not, you go down as a COVID death, right? I mean, they have to do that because who knows?
That's a state by state issue. That's not necessarily the case anymore. They're getting a little bit better at tracking that data, but nonetheless, it's a real concern. And you're correct. The death rate in Florida of the 65 plus population, I mean, that's driving the vast majority of the deaths. So right. I think the real conversation in Florida needs to be, why are we quarantining the healthy? Why aren't we quarantining the vulnerable? And the better conversation is, what should we do about the teachers that do have these chronic conditions that put them at increased risk? What can be done to modify their pensions so that they might be able to take an early retirement and not go in the classroom? What can we do to create effective leaves of absence or convert these teachers to online education that truly have these conditions that put them at risk? Now, that's a real serious question. But the children are best off in school. Half the kids in the country get their biggest meal of the day in school.
In your op-ed, which I thought was brilliantly written, by the way, and before we run out of time, we're going to talk about the flack you got over it, which is the world we live in now. Dr. Lee Gross with us, Southwest Florida. You said a growing body of evidence also finds that kids don't transmit the virus. A recent study out of Germany concludes that schools didn't increase virus prevalence. A study from the Netherlands, which is open, finds that transmission among children or from children to adults is uncommon. And you said empirically COVID cases didn't rise in Europe after schools reopened there in the spring. So I thought this was about science and data. We have the science and data from Germany, the Netherlands, and throughout Europe, which says go to school, no problem, yet we're closing schools. Why?
Yeah, I think the science is still developing. I mean, those were good studies. They were relatively small studies. I think the experience is still being developed. But again, the fear campaign that is going on to get us into hiding, frankly, it's election year politics. It is, and it's one thing when we're talking about smearing your political opponents. Another thing when you're talking about affecting people's lives forever. So this is, this will continue to play out. I've got thick skin, so we'll go ahead and take some of the arrows for speaking some of the truth on this. But again, I think we need to sort of change the conversation to, how do we function as a society with this virus around us? Because, the polls show that 50% of the people in the country will refuse a vaccine when it's available. And of the other 50%, half of them said that they're on the fence. So if only 25% of the people are going to take a vaccine, why are we holding up opening the schools for a vaccine? I don't. What is the threshold? What metric are we using for a safe opening? Well, the metric for the safe opening is that the kids are doing generally pretty well with this disease, better than the adults. Those are the metrics. That's the experience we're getting with this virus.
So the metric for closing schools is the election on November 3rd. So that's their metric, right? There's no science and data that's backing anything they do. So their metric is November 3rd. Get Trump out, elect Biden, and somehow there'll be a magic vaccine that, as you say, people aren't going to take. Anyway, we're with Dr. Lee Gross. He's a practicing family physician in North Point, Florida. That's Southwest Florida. He's president of Docs for Patient Care Foundation, a national health policy think tank of practicing physicians, and he's a partner of the Job Creators Network Foundation. Been shamed now on social media. Now you've got sucked into that war. How is your family reacting to that?
We're doing great. The question, on Twitter is, Dr. Gross, are you sending your kids to school? Well, guess what? my child is a sophomore at Florida State University, and he's going back to campus. He's disappointed that many of his classes have been converted to online because he realizes that is not the education that he signed up for. He realizes he is not getting anything close to what he's promised, and he's sort of questioning, why am I spending so much money for a correspondence school? I could do that for much less money and stay on your couch. I don't need to go up to Tallahassee for that. But we're sending him to Tallahassee, and he will be going to classes when the classrooms open in the fall.
Dr. Lee Gross, practicing family physician, Southwest Florida, part of the Job Creators Network Foundation. Doctor, thanks for being with us.
Thanks for having me. Appreciate it.